So welcome everybody to today's webinar. I'm so glad you all could join us for today, July 14th. Oh my gosh, I've lost track of time. Our conference is coming up next week, so time has been a complete blur to me. So if you're not familiar with ASHA, the American School Health Association, our vision is we envision healthy students who learn and achieve in a safe and healthy environment, nurtured by caring adults, functioning within coordinated school and community support systems. Some of the ASHA member benefits: if you join, you get access online to our Journal of School Health, free continuing education credits that would include webinars like today, on-demand webinars, and Josh self-studies through our learning portal, as well as forums for you to connect with other school health professionals and a discount to the American Academy of Pediatrics titles. Another reminder, if you haven't heard, our conference is coming up next week. So we have an in-person portion of our conference next week in Albuquerque, New Mexico, and then a virtual portion on Monday, the 25th. Registration is still open. You can register for either in-person, or if you can only attend virtually, that is fine, and you can register for that as well. So with that, I'm going to go ahead and turn it over to today's presenters.
Thank you so much, Caitlin. I am Charley Daniel from the Tulsa Health Department School Health Program. It's all about kids. And Bridget Parra is also with us. She is the supervisor for the It's All About Kids program. So we're going to be presenting today. I'm going to share my screen and make sure I push all the right buttons. Okay, does everyone see my screen? Perfect. Okay, so we would ask if you could, just so we can see your faces, that you please start your webcam. Just like Caitlin has asked, everybody introduce yourself in the chat. Tell us, where do you work? Where are you from? And then what is your favorite thing about your job? And then, of course, we want you to interact as we go. That motivates us when we see your smiling faces, when you're giving us applaud or you're laughing at our silly jokes that we might have. So please feel free to interact as we are going through our presentation. We'll try to get to your messages in the chat, but we will leave the last 10 or so minutes for questions and answers. And then we'll also provide our contact information. So if you want to follow up after this webinar, we're always happy to have conversations and collaborate with you at the end of the webinar. So we will be dropping some links in the chat too. And then at the very end, Caitlin's going to send out our PowerPoint to you. She's going to send out all the resources that we share. And then if there's anything else you guys want, again, you guys can ask us for that. So our presentation today, we're going to be introducing strategies for community partners to support the implementation of the WSCC model in schools. We're going to be sharing some examples of how we have partnered with schools and how we have collaborated with other community partners in our area. We hope that you leave today with some new ideas of possible partnerships in your area. The It's All About Kids program is a program of the Tulsa Health Department. The Tulsa Health Department's vision is to make Tulsa County the healthiest county in the country. Our mission is to improve the health and well-being of all Tulsa County residents. And as an agency, we are committed to the constant pursuit of a healthier Tulsa by carrying out our core values, which is treating all people with dignity and respect, putting the needs of our clients ahead of anything and everything else. We are accountable to each other and to the people that we serve, and we are empowering residents to make the healthy and safe choices. So today, our objectives of our session is that you will be able to identify community partners to assist with the implementation of the WSCC model. You'll be able to describe the importance of collaborative efforts implementing community programs within the school, and then how to initiate a memorandum of understanding between a community partner and a school. So welcome, this is our team. As I mentioned before, I'm the school health manager for the It's All About Kids program. Charley Daniel and Bridget Parra will also be talking with you all today. She's the supervisor. We are lucky to have 6 health education and promotion specialists on our team. And then we have a part-time nurse consultant, and you'll see that she wears many hats with our team. She is partly retired, so we try to hold on to her as much as we can, but she's also on our team. The It's All About Kids program is a school health program of the Tulsa Health Department, which we align with the whole school, whole community, whole child model. Our mission is to improve the overall health and academic achievement of Tulsa County school-age children in collaboration with students, schools, and the community by aligning learning and health through comprehensive nutrition and health education. During the 21-22 school year, we had 65 partnering schools here in Tulsa County within 10 school districts. And just to put that into perspective, we have 14 school districts within Tulsa County. We are now in the process of onboarding our schools for the 2022-2023 school year. And we have 47 schools that have actually completed our school health readiness assessment. And we are in the middle of having those planning meetings and getting them scheduled for this school year. Our program does offer resources and education of all areas of the WIS model, which can be found on our website, tulsaplay.org. And we're going to be dropping different links as we are talking about different parts of our program and community partners that we have. That way you can review them when you have a little bit more time.
Okay, so now we are going to look at the WIS model. We are going to drop in the chat a video that you can review if you're not familiar with the WIS model, or if it is something that you would want to share with someone you're trying to be partners with, or maybe administration. It's just a great quick 2-minute video that the ASCD and CDC have put together with the background of the WIS model. So why are community partnerships important for schools? That's what we're going to talk about today. As you look at the WIS model, you see the gold ring outside of the WIS model, and that reflects the importance of support from and partnerships with the community. Schools are a part of our community. I know you working with schools probably understand that, but sometimes I think that gets forgotten. So it's always important to remind people that schools are a part of our community, a very big part. When the WIS model was created, it was not designed with the idea that schools would adopt and implement it on their own. Schools have limited resources to meet a wide array of needs of students and their families. Partnerships and collaborations with community agencies are essential to helping schools secure the resources and support necessary to implement the WIS model. So how can community partnerships assist schools with the implementation of the WIS model? So we're going to look at 3 areas. We have resources, support, and achieving the goal. So with resources, that can look like having a space for programming or even an event for your school. For example, with us, we have worked with districts here in Tulsa County who would want to do summer programming. And so we work collaboratively with them to offer the programming, but also to have the space. When we're doing nutrition, we use our cooking demo space to do that with the students. And then we also have big community rooms where we're able to do physical activity with students. And then we also have outdoor space where they can enjoy their lunch, or again, we can do activities out there depending on the weather. It gets really hot in the summer in Oklahoma, so that just depends. And then materials needed for programming or events. Again, that can be anything from if you're doing something with the school where it is, maybe they need food, or they need plates and cups and things for an event that they're trying to do. Tapping into those partners that would be able to maybe donate those things or purchase those things for your school. Again, we often get requests from our schools, especially with our PE teachers. We have lots of equipment that we have been able to purchase. And so there's a lot of times with their budget, they don't have that. So they will ask us if they can borrow it for some units that they might be doing. And we're always happy to help and give that equipment to them. And then obviously cash or in-kind donations is a great resource. Out there are so many organizations that are willing to help partner with schools and being able to provide that cash or in-kind donation if there's something that is not within your budget at the school. We know all schools have budgets that have to go, the monies have to go specific places. So having that in kind is always nice to have. Support can look like staff and volunteers. So for example, we are working with something called Paid in Play Spaces. Charlie's going to drop that in the chat as well. And they work with schools to create fun, interactive recess playgrounds. They come out and they kind of observe what's going on the playground during a typical day, and then what areas could be enhanced. And so a lot of the times they'll need volunteers, schools will need volunteers to help get that painted onto their playground. And so community partners like us can come help do that. Your churches could do that. Parents from the community can do that. So it just, it can look like that. I know a lot of our schools use college students or grandparents to come in during the school day. And if they need reading partners or math partners, they're there to help with that. So just some ways to reach out for staff or volunteers. Curriculum, we have a lot of a curriculum that we are able to purchase. And so especially we have bully prevention lessons, we have mindfulness lessons. And our schools, whenever we're partnering with them, want to ensure that the messages that we're giving with the curriculum is the same that they're doing with at their district, and vice versa. We want to make sure we're doing that as well. But then there's a lot of times that we'll have counselors reach out or school nurses reach out and say, hey, do you have a curriculum on this? I would like to do a unit, and we are happy to let them borrow it. And sometimes they want to borrow it before they purchase it. And so it's a great way to get information if they need it that way. And then again, just access to resources. We do a lot of cross collaboration. And so we know that we are not going to be able to alone do all of the things that our schools need. So definitely, if we're not able to do it, we are happy to refer and make connections with other community partners for our schools so that they can have access to different resources. And then overall, achieving the goal of implementing the WSCC model component areas. For us, health education, for example, is one that we are really good at. We have a team of health educators. We are experts in this area. And so we obviously get asked for assistance in that area. But then the counseling, psychological, and social services side, I know a lot of our schools here in Tulsa County have actual organizations that are on site that can help with those things, have experts in that area. And so it's a great way to get the students the help that they need right there on site at their schools. And as we know, schools are one place that is one of the most efficient systems for reaching children and youth to provide these types of programs and services. So as we go through today, we've all heard the African proverb, it takes a village to raise a child, meaning that all in the village have a part in raising that child in a safe and healthy environment. The same is true for schools. So it takes a community to raise a school. Everyone in the community has a part in raising the school to have a safe and healthy environment. So as we go through today, just kind of keep that in mind when we talk about how communities are important for implementing the WSCC model. This is a handout that we have created. It aligns the WSCC components with the programming that we are able to provide within our schools. And so if we have a school that's wanting to partner with us, we give this information to them so they can see what areas that they might want us to come in and help with. Majority of the WSCC components are on here. Counseling, psychological, and social services. And the health services is one that we don't do a lot of direct support with, not because we don't want to, just because we do know that there's experts in those areas. But if they come to us and they want to partner and do some sort of event, we're always there to help out in any way we can. And so like everyone during the pandemic, we had to turn to all things virtual. So you'll see a blue square that would be in person, and then you'll see a red square that would be for virtual. And we'll get into that. So the silver lining for us is that even though COVID came about and it caused things to slow down and stop and halt, we were able to pivot, and now we can reach more communities when they reach out to us for resources. we can only provide direct services to Tulsa County schools, but if a school reaches out from another area, we can direct them to our website now, and they have access to our virtual lessons. So we will look at our virtual lessons now. So we have a great talented team who had knowledge of iMovie and YouTube and how to get all this on our website and help us to stay connected to our schools during the pandemic, which was amazing. And so we took our health education lessons and just put them into video format. As you can imagine, some of our early videos were really fun to watch back because now we have learned so much. But when we were trying to get going, we just worked with what we had. And so now all of our lessons, whether they're in person or virtual, align with national and state health education standards, and they have CASEL competencies on them as well. So the first picture that you'll see at the top on the left corner is we had to pivot to doing human growth and development, or what is kind of the puberty talk, with our 5th grade students. Our schools really wanted us to still do that lesson. So we worked collaboratively with the school, with the 5th grade teachers and the nurses to ensure that we were able to provide that education. And so we did it live via Zoom. So we would meet with the schools and the nurses and the teachers to ensure that we had a good Zoom link. We had good microphones. The videos were good. We could see both. They could see us, we could see them. And then whenever we needed to pull up stuff, we had access to pull up stuff and put it on the screen. And the teachers understood that they would be calling on students if students had questions, since we were not actually there, but then we could answer their question. So that was a great collaboration and partnership. The one below it is our It's All About Kinesthetics After School program. It's a functional fitness program with health education as well. And so now we have a web page on our website that schools have access to that has videos that go along with the curriculum. So when we couldn't be there in person, they can utilize that resource as well. And then you'll see on the right, that picture is with our Hillcrest Medical Center here in Tulsa. We have a partnership with them. They do the Don't Bug Me campaign. As you can imagine, during COVID, it was don't bug me with the flu, don't bug me with COVID, right? So we took our health education, and we had our nurse consultant, who is Penelope Ayak. She's Professor Penelope Ayak. She likes to be a character. And our Louie and Chewy mascot, who is the bug. And they went through hand washing. They went through why we wear a mask, how we social distance. When we are sick, we need to stay home. So those messages were consistently getting out to our students, to their teachers, and to their families. So it's a great way for us to stay connected. And then we have a teachers tab, and Charlie's going to pull up a fun activity for us on that teachers tab. And it is going to be a brain break. So if you guys will all kind of participate, you can just, this video is real fun, and our kids love doing this stuff. So take a quick brain break.
Hi friends, we're going to be doing a brain break. It's called I Bet You Can't Do This. So you're going to stick your arm out and your pointer finger, and you're going to try to circle your finger while circling your wrist in the opposite direction. Can you do it? Only 1 in 10 people can.
All right, so I don't know if anybody was successful on that. There's 72 people, it says on here. So 1 in 10 people can do it. So I wonder if anybody was able to do it, but that's just a fun little thing to do with the students, and that can be found on our teachers tab. We have all sorts of things. We have action-based learning techniques. We have brain breaks. We have inside recess games and nutrition recipes that can be done within the school or sent home with parents to do with their kids, along with our virtual lessons. So let's talk about our professional development and employee wellness. So employee wellness for us, we have on our website a page of resource for employee wellness. We have developed different trackers for physical activity, habits, and nutrition. And so our schools can access those and utilize those at any time. It can be a whole school thing, or if there's just 2 people within a school that want to do it, they have access to it. And so there, and then we also put on there a way for them to, if they have done the challenge, they can submit a quick little survey for us, and then we put them in to get a prize for a drawing. So that is a fun way to get involved with them. And then we go out and deliver it and have fun with them. If the school has something that they're doing on their own, again, and they don't have maybe the funds or whatever to do incentives for their teachers, they always can reach out to us and we will help them in any way that we can. We always try to do something fitness related. So it could be a water bottle, it could be resistance bands, it could be a small set of weights, it could be fanny packs. So when they're out running, they have something to put their stuff in. So we always try to help out in that way. The YMCA is also a place that helps with discounts for teachers. If you are somewhere and you have an organization that has a gym, always inquire about that. Discounts for teachers, most places will do that. Then there's also a resource Charlie's going to drop in. It's an online resource, Open Phys Ed. If you haven't heard of this, it's a great free resource. We learned about them going to some of our national conferences. All you have to do to gain access is to create a profile. And then you have access. They have stuff for field days. They have stuff for dance units. They have SEL units. They have all different types of stuff. We've used some of their stuff. It's great, especially if you have a new PE teacher. We've given this resource a lot to a lot of new PE teachers when they are not sure where to start or what to do. But we've also shared it with PE teachers who are just like, man, I've done everything. I need a spark of something new, something different. So it's a great resource and it's free. And then we partner with the Oklahoma State Department of Education a lot, especially around professional development. Currently, Engage OK is going on. Charlie's sharing that resource with you guys. And it's our State Department of Education. They go down around to different regions of the state and talk about what's going to happen in education in Oklahoma. And so we tend to attend the part around health and wellness within schools. So this year, the Health Education Act is going to be discussed. We are so excited. In Oklahoma, we finally passed a Health Education Act. So they're going to be talking a lot about that. They're going to be talking a lot about student well-being through health education, and then focusing on increasing physical activity opportunities throughout the day. And then we also participate in the Oklahoma WISC Coalition. On that coalition, it is a state coalition, and it's the Department of Ed, Department of Health. It has health educators like us. It has admin, school nurses, counselors, PE teachers, and it's a great way for all of us to come together and we discuss how to implement WISC within schools and get ideas from each other. So having that coalition has been amazing. They put on the Institute. We participate in helping prepare for the Institute and planning for it. So this year we focused again on skills-based health education since it's coming to our state. We had a national speaker, Dr. Talia John. She came. Charlie's probably sharing that information with you in the chat as well. And it was a great success. We learned so much from her. And then we also do sit less, move more, learn better. We work with our tribal partners for that and State Department of Health. The goal here, it's a free training. So this year, again, we're going to be focusing on integrating health education and promoting mental health and well-being with physical activity. And they will learn different ways to promote health education concepts, experiential learning, team building, cooperation, and communication. So all those resources, I'm sure Charlie has dropped for you guys to check out. But we often will share this stuff on our social media as a partner. We will share this out, make sure our schools know about it, encourage them to be a part. And then if we're doing something, we can count on our community, our schools to also share that information out. So it's just a great way to do that. We offer professional developments around different topics that we provide within our schools. And so it's just another another resource for our teachers. So I talked about earlier with partnerships, there's a lot of crossover, which is great so that we can all help our schools get what they need. The left picture is a farm to student event. Our OSU extension, which is Oklahoma State University here in Oklahoma, along with the school district, their child nutrition team, our team, they put on this great program so students can learn where their food comes from. They get hands-on learning experience, getting to play with worms, plant a tomato or a pepper plant. They get to taste exotic fruits. They milk a cow, and then they get to play a game. So all the students from that school will go through rotations and experience it. And it's just a fun day for everyone. The middle picture is our nutrition or our blender bike. We work a lot with district child nutrition programs. We found when we were going to schools that their child nutrition programs had education that they were wanting to do and wanting to provide, but their district or their school didn't really know about that. So we made sure that when we were having meetings with schools, we encouraged them to use their child nutrition program, and then we can come in and fill the gap. So we've built great partnerships with the district's child nutrition programs to help each other out. And Blender Bike is one of those ways. We are not able to order food. So we look to their child nutrition team. They get it at a lower cost. They get it all ordered for us, and we work together to make sure that Blender Bike day goes smoothly. And then the last picture is the Tulsa Drillers, is our baseball team here. So if you have a local team, always reach out to them, see if they would want to do some programming with you or partner with you in some way. Their mascot is a bull. His name is Hornsby. And so he helps us with what is called the Bully Busters Assembly. And we go in with them. We do education around how to be a bully buster, how to identify different types of bullying, what bullying is and is not. And it's just a fun, great interactive program. And the kids love seeing Hornsby. They get so excited. So it's been a really good partnership for us. And then we also work with behavioral health systems. This summer, we provided a summer camp with Creos here in Tulsa, and they wanted nutrition education as well as physical activity. And so their students got to experience the blender bike, making smoothies and hummus. And they also got to do some fun physical activity and also learn ways that physical activity can help you self-regulate. A lot of those students have trouble self-regulating. And so we were able to give them some tools to use, and the staff there also really enjoyed that part. So again, some great collaboration in different areas.
So you may be wondering what our process is for partnering with all of these school districts and community partners. The Tulsa Health Department, we use what we call a Memorandum of Understanding, or an MOU, which is a non-binding agreement that states each party's intention to take action, conduct business transactions, or form new partnerships. So this type of agreement may also be referred to as a letter of intent or memorandum of agreement. It is important to know that MOUs are respected, even though there's no bargaining for money or exchanges. Both parties have the right to make changes within 30 days of a written notice if necessary. So during COVID, as you can imagine, our entire nation shut down. So we weren't able to go into schools. We actually pivoted to doing some COVID response work, and our schools, they weren't in school during that time. Last year, schools were getting back into session. Students and teachers were back in the classrooms, which we were so excited about. However, since we are a program of the Tulsa Health Department, we still had some stipulations as far as requiring students and teachers to wear masks when we come into their classrooms. This wasn't a mandate of our state. And so we did have some difficulties with going in because everybody wasn't required to wear a mask. So we were only able to go into those schools that were able to follow our process. Our virtual lessons came in very handy during this time because we were able to say, we still can't come in person, but you guys can use our virtual lessons. And then luckily, when the numbers went down, we were able to go into the schools and we didn't have to require them to wear masks. This was like this was in March, April time. And then our staff had the option if they wanted to wear a mask or not when they went into schools. So on the left, you can see an example of one of the first page of our MOU with a school district. Typically our MOUs are about 9 pages long. And you can see on the right, all the different areas that we include in the MOU that our THD legal department, they actually create this document. We do renew our MOUs every year with our school districts. So not the individual schools, just our school districts. And this renewing it every year gives the schools in our program the opportunity to make changes if any are needed. So if we did a program change, we can make sure that that's included in the MOU. This renewal process typically takes place in the February-March timeframe, which seems super early, but let me just tell you, it is a process. It's not always top priority on everybody's list. So we start this process in about February, March. We make changes, the schools look over it, make sure that they don't have any changes, and then it goes for the districts to actually do approvals. So once both parties have agreed on the MOU, then we start the signatures of all the MOUs. So as you can imagine, each district has their own process for signing the MOUs. Some MOUs have to go in front of their school board, while others can be signed off from just the superintendent. It is important that we note that our program is completely free for Tulsa County schools. So that makes it a little bit easier for just a superintendent to sign because we're not doing any money transactions with our partnership. There are some other partners within our community that they do have some funds that they're transitioning. So they might have to take a little bit more of a rigorous process compared to what we have to do. Once we get signatures from both parties, then that's what we say is a fully executed document. And like I've mentioned before, if anything needs to change within that school year, just a 30-day written notice is all that's needed to make the change. Or if we can wait till the next year, we'll make the change before we send it out for signatures. So you might be thinking, what happens if the MOU is not signed? Well, if that happens, we would not be able to facilitate our in-person classes with the students. However, we would still be able to work with the teachers through professional development. And luckily, we haven't experienced this yet since we have been around since 2004. So now where we're at in this process, we've been working with these school districts for quite a while, and most of them have, we've gone through this process every year. So getting the signatures on our MOUs hasn't been an issue. Let's knock on wood that doesn't ever become an issue. What you can see here, this is an example of one of our districts. They do participating addendums. So this particular school district created this standard document for all of their community partners to complete each school year. And they're all signed by their school board during the July board meeting. Our legal department, they did have to review this document and they approved it for us to use. It's nice. This document's nice because it's a fillable form that we can just quickly enter in, our program information into it. And it's pretty simple and easy to understand. I will also note that with this specific school district, we have a 3-year MOU with the district. So every 3 years, we look at that MOU and we update it, and then every year we look at the participating addendum. So it is nice to have that 3-year because then you're not constantly always having to change things. However, in this document, it's only 2 pages. So this is much nicer to just have to do 2 pages instead of looking at like 9 pages. So I did talk about our THD legal team being involved in the MOU process. So just really quick, I'll explain how they get involved. Whenever an internal THD program is needing assistance from our legal team, we simply complete the form that you see on the right, which is also fillable. When we are completing this form, they ask us to be as detailed as possible so they know what we are needing them to do. And like I said, now that most of our MOUs have been established with our school districts, this process is pretty simple because we're not making a lot of changes to them. Once we have sent this to our legal department, they make any updates, which is typically just like the years of when the MOU is going to be in effect. Then they send them to the district for signatures. So I typically prefer the MOUs to be emailed from someone in our legal department to our school districts, just in case there are any legal questions. They're asking the right people and I don't have to be involved in those legal questions back and forth. So that's just our internal process. This isn't the process that our schools do. This is just what we do to get our legal team involved in what we do. So now for the fun stuff, we're going to show you around our website, thetulsaplay.org, so you can see some of the resources that we have to offer to our schools and community partners, as well as how schools would become a partner of ours.
Okay, so on our homepage, you will find a video that we're going to show you here in a little bit about our program, our mission, purpose, foundation, all of that. And then we have the WSCC model front and center. We also have national school health resources and state school health resources listed here. And then we have news and events of things that are going on either around our state, locally, or if it's nationally, we share that information out as well. If a school wants to become a partner with us, then they go to the partnership tab and they will, we require an assessment. And so our deadline it starts from May 1st to September 1st. That's the window to submit. And then we also require a planning meeting with each school that wants to partner with us. And that has to be done by September 16th of the year. That way we can get our calendar figured out. And we also meet with the school's leadership so they know what we're coming in to do for their school, and they have relayed to us what is important around health that we help them with. The WSCC model component programming sheet is what I showed you a little bit earlier. So we always give them that so they can look at that. They do get to choose 4 in-person lessons for us to come do. They do 2 in the fall, 2 in the spring. And then we also have professional development offerings that we provide them so they can see what we'll be providing, how long they are, and what they can expect. And then we have a PDF version of the assessment. The state requires data from us. And so they can use this to see what data that they will need to pull, but also they can work with the group of people that is filling out the assessment to see what areas of health they really want us to help with this year. And then once that is, they can submit it electronically. And once that's submitted, we receive it, we reach out to them, schedule a planning meeting. And like I said, during that planning meeting, we get everything on our calendar. And so that way we know for the year where we're going and what we're doing. And the school has it as well. The schools tab is aligned with the WSCC model. You'll see all 10 components on here, and you can click on these and it tells you what we offer in those areas. At this point in time, we are having some updates done to our website. So, but this will have all the employee wellness stuff I was talking about earlier with the trackers in the different areas, and then a way for them to let us know so they can be put into a drawing for a prize. Then we have our teachers tab, and that's where our virtual lessons are housed. We have a lot of action-based learning information, brain breaks. We always get asked about inside recess, so we started putting them here, especially in those colder months. We can do a PD around that, but if they don't have time for a PD necessarily, there's games posted here for them to try. And then we have our nutrition recipes, again, that teachers can utilize in their classroom and share and do literacy and math with, or they can send them home with their parents or the students for them to do with their parents. And then we do have an action-based learning page. All of our team has been certified in action-based learning. And so it's all about how movement helps your student learn better. And so a lot of our schools ask us to come help with that in their school. And then we have our contact page. So if you ever want to leave us a message or you want to reach out to anyone on our staff, we're all listed here.
All right, so now I'm going to show you that you've heard about all these resources and all the great things that we do, our team in action. So that way you can get a visual for what it actually looks like when we're in the schools. All right, so we hope you guys enjoyed that video. It's fun to actually get to see our team in action and getting to work with students and our teachers in the classrooms and in their schools. So now what we're going to do, this is called cardio review. This is a fun, active way for us to review information that we have taught. And this is something that we give to teachers. So after we've taught them how to use this resource, we give them this poster and they can do a review with their students, but do an active review. And the kids, they find whenever we do it that they love it. So we're going to do this with you guys. If you would stand up, if you can. Stand up, and basically what we're going to do is we're going to ask you a question, and we would say, if you think the answer is A, you're going to do windmills. So we're crossing that midline. And then B is bananas. So you're going to show us what you think the answer is instead of telling us. So you'll do bananas. C is knee to elbow. So again, we're crossing that midline. And then D is slapping leather. And this is my favorite one to watch the little kiddos do because they haven't quite figured out how to put their foot behind their body and touch it with the opposite hand. So we call this cardio review because on the opposite side of this poster, it's actual physical activities, but we're going to activate our brains because we still have a little bit of the workday left. So the first question is, collaborating with community partners for the implementation of the WSCC model provides students a variety of opportunities. Show me, do you agree with that statement? A, B, somewhat agree, D, neither agree or disagree, or D, do you disagree with that statement? Thank you guys so much for participating. Yes, it's windmills, it's A. So yeah, collaborating with community partners is definitely provide students a variety of opportunities to learn from different people. We always say that we're the special teachers that get to come in. Teachers tell them the same thing over and over again. And then when we come in, that light bulb goes off and the teacher's like, I have been saying this for days. We're like, it's just us, I think. Okay, one more question for you. The school health resources can be found on A, the tulsaplay.org website, B, Facebook, D, Instagram, or D, all of the above. I see you guys slapping your leather. That's awesome. Thank you guys so much for participating in that. So again, this is just a fun, quick activity that we can do with students to get them up really quick. Teachers use it, to ask them different content questions just to kind of gauge where they're at. You can do true, false. Again, it would be A or B. There's multiple different ways to use this, but thanks for participating with that. Now that you guys know that we have all these different resources, we would hope that you follow us on Facebook or like us on Facebook and Instagram. Check out our YouTube page. Check out our resources online and feel free to reach out to us if you have any questions. We are here for all kids. So if there's a resource that you want, ask us, and we are happy to share our resources with you guys. So like us, follow us, comment on our stuff, let us know that we're goofy and silly, or show us your kids and students interacting with us. We would love to see that. So now we want to hear from you. You guys have been quiet. Thanks for listening to us. We want to know from you. Tell us in the chat at least one idea that you learned about working with community partners in your schools. So from all these ideas, did it spark any interest? Did it spark any ideas that you're like, oh, why didn't I think of that? Why didn't I reach out to them before? Or if you are a community partner, what other community partners can you collaborate with? Like Bridget mentioned, the Tulsa Drillers. We collaborate with them to provide our schools some different unique experiences for our kiddos.
So it looks like Cheryl says they fill in the gaps that we often can't fill ourselves, which is very true, very important.
As you guys are reflecting and adding stuff into the chat, I'm just going to go through a little bit more of this. So again, we need to acknowledge that we do get some funding from the Maternal and Child Health Title V Block Grant. We thank them for funding us and letting us go into schools and providing these resources to our schools for free. And then if you do want to contact us, here's our contact information. Again, you can call us, you can email us. we're always looking for ways to collaborate. So please reach out to us and let us know how we can help you guys.
Okay, so we've had some more people. Community partners are vital for implementing the WSCC model. The key to working with staff, parents, administration, and administrators and resources, accessible videos, love that. Love the mascot idea. Changed my mind of how to have conversations with communities about the WSCC model and school health. That's awesome. Reaching out to sports team mascots to engage with students. Our students love that. We used to have a soccer team and they had a mascot as well. But then the team was no longer. So we used to have that guy come too. They love the mascot. And then loved our school business partnerships and community volunteer organizations. I love the school health readiness assessment. That assessment has been amazing for us to make sure that we are providing exactly what our schools need. Like I said, it can be overwhelming with all the components, especially. And so it helps us to help them focus in different areas and help them give ideas. And then, like I said, if we can't fulfill it, we always refer to other community partners that can help them. Let's see. I appreciate the information on MOUs. Can't wait to share brain breaks with my district. I need to find a blender bike. Thank you so much. Charlie knows about the blender bike more than I do as far as that. Charlie, do you have information to share about that?
Yeah, I dropped it in the chat. We got it from Rock the Bike. It is the professional one, so it's really an adult bike. So we only let our 3rd through 5th grade students ride the bike, or we measure them to make sure that they're tall enough so the pedal doesn't come back and hit their shins. But these go over great during like family engagement nights too. So if we teach the education during the school day, then the kids get excited to show their parents for that family engagement portion. You know, look what I did today in school, and they're teaching their parents what they learned. And we kind of just sit back and let them run the show there. So yeah, Rock the Bike. It's kind of pricey, but I'll tell you, it's paid off. Like, we have community partners now asking to borrow it for different events that we're doing or that they're doing. So definitely has paid off. I know a couple of our school districts, they got grants to fund the Rock the Bike because you can add nutrition education to it and physical activity, all those fun topics. So yeah, definitely check that out.
And let's see, community partnerships enable schools to widen their influence, involving the retirement homes and having honorary grandparents in a K-1 class, and then reviewing the Health Education Act. Like I said, we are excited here in Oklahoma to have that passed. So we're really excited to see where that direction is going to go for our kiddos here.
So we want to open it up now to you guys. We have about 10 minutes left to see if you have any questions. You can ask them in the chat. I don't know if you can unmute your mic. You might be able to, but we're open for questions as long as you guys want to stay on. And like I had mentioned, we'll be sharing our PowerPoint and then some of the resources I shared in the chat. And then if there's anything else you want from us, you just have to ask us and we're happy to share.
And if you don't have any questions right now, like Charlie said, always feel free to reach out to us. Sometimes when you get information, sometimes it's like, wait, what is my question? So.
And while we're waiting, in case people are typing their questions into chat, I want to remind everyone that this was recorded. So it will be going out hopefully by the end of the day, if not tomorrow sometime, the recording, as well as any resources that Charlie and Bridget wish to share. And that includes the PowerPoint slides. So stay tuned for that. Also, if you are wanting to receive continuing education for this, which we are approved for check through InCheck. So anyone who has CHES, MCHES, as well as general continuing education units, you can fill out our evaluation, which I'm going to post in the chat, and it'll also be going out in the email. You will have to create an account if you haven't already done so through our member portal, otherwise log in. And I will preface this by saying we recently started using a new system. So if you happen to run into any issues doing the evaluation or getting your continuing ed, please feel free to reach out to me. I'll drop our email address in here so you can email me with any questions, and let me know if anything pops up. But again, stay tuned for that email within the next day.
Okay, I think we have had a few questions here. Let me see. Oh wait, I think where did my chat go? Okay. It says here, how do you engage a school that has recently adopted the WSCC model? I would say, and Charlie jump in, obviously, I would say for us, the way that we engage is just making sure, first of all, there's an awareness. There's a lot of times that our schools are not aware of the WSCC model. And so part of that is just us also bringing awareness to that and what it is and how it works. But if they are adopting it, just for us to say, what are your goals with the WSCC model and how can we come in and be a part of that? Where do we fit in with that? Charlie, do you have anything extra that you would want to add there?
No, I think that what we've really been trying to do here in the state of Oklahoma is just bring awareness to what the WSCC model is. Most of our schools are doing something with each of the component areas, but maybe they don't realize it. And then, like Bridget said, just helping them fill the gaps of where they might need some more help, or, bringing some fun to some of the stuff that they're doing is what we're able to do. But really in Oklahoma, we're still having to bring awareness to what is the WSCC model and what does that even mean?
Another question is, how many schools do you currently work with? Last year we had 65 partnering schools. Again, they have to fill out the assessment before the deadline. And as of this year, we start doing our assessments in May, so they go through the summer. We are at 47 schools currently that have done the whole process with us. Where can we find information for each of the modules of the model? The CDC website has it all broken down by each component. You can look into it. They have a virtual school that goes through the different components as well, that you can kind of read through and go through very interactively. So you can find it there as well. How long do you continue to do a program? Do you prepare another activity in the program? Do you want to take that, Charlie?
Yeah, so typically our program, we base it off of the needs assessment that they complete at the beginning of the year. They're choosing the 4 different topics. So most of our topics, they're a 30-minute presentation that our staff come in and they facilitate. But if a school wants more, then all they have to do is ask us. But with partnering with so many schools and only having 6 educators to be able to go in, we can't really do more than that. So we're just kind of giving them a taste of what health education is, and then we're there to support them how they want to implement it into their classroom. I'm not sure what the second part is asking. I apologize. So you want to expand on it? I'm happy to expand if you give me a little bit more on that. And then I did put into the chat for family engagement. We have made that interactive too. So if you go to the family engagement page on our website, there's math and literacy activities and then action-based STEM learning activities. If you open up the PDF of the document, we've now made it geared more towards students and their guardian or their parents or their siblings. Their activities that they can do quickly with each other. And if you read it and you're like, what in the world does that mean? Because I'm very visual. I need to see it. If you click on the title of the activity, a video will pop up of us doing the activity. And then all the materials for each of the activities, we have those just in case, a parent is like, oh, what are sight words? I mean, I'm sure they know what sight words are, but we offer those to them. Sometimes fitness cards are like, what are some physical activities? We have those cards attached there, but again, we want them to use sight words that they have in their classes, or if they're working on counting, there's activities to do in there. So you guys can check those out and print the books off. use the videos if you want.
I have one that says, I would love to hear any additional community involvement activities that participants or presentation team have done with their schools. If I'm reading this correctly, hopefully I am. I know we also have, like we talked about, there's something called the Discovery Lab here in Tulsa, and they actually partner with Tulsa Public Schools to do all of their STEM type of education with their students. So it's a great community partnership that comes to mind. Charley, is there another one that, Operation Aware is another community partner that will partner, and they focus primarily on drug prevention and what's the other thing, Charley? I'm forgetting. Drug prevention and something else.
Prevention.
Drug and alcohol prevention. And so they're a really great resource that will go in and do stuff with theirs. There's Global Gardens that have stuff on site to do gardening with their kids. So those are just some ideas. It says you provide 4 in-person activities for each school, or is it district? So we do it for each school. So we may meet with the district at the district level. So one of our districts this year here in Broken Arrow, we met with the district leaders, and they chose 2 that every school would have, and then they let each school choose 2. So they got a total of 4, but there's 16 schools within that district. So if you can imagine, again, like Charley was saying, for each of those schools, and that's only one district. And then we work within 8 different districts. And so, yes, we try to give them each the opportunity of having 4 total topics. And then we do professional development and resource sharing as well during that. So I think that's all the questions I see in here. So thank you to everyone for your questions and your comments. We appreciate it.
All right, well, with that, I think we're going to wrap up today's webinar. I appreciate Charley and Bridget, you stopping by and presenting. You all do such amazing work in Tulsa and Oklahoma. And I thank you for sharing that with all of us. So again, everyone, keep an eye out in your emails for an email later today or tomorrow with resources and evaluation. And as always, if you have any questions, feel free to reach out to us. Thank you all. Have a great day.
Thank you.